Step number 1. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Step number 2. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient, and also perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Hand hygiene deters the spread of microorganisms. Step number 3. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step number 4. Transport medications to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Step number 5. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and help prevent errors. Step number 6. Explain the procedure to the patient. This helps to gain cooperation and to allay anxiety. Step number 7. Fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Step number 8. Turn on the power button of air compressor. This is to ensure the efficient vaporization. Step number 9. Observe the fine spray from the nebulizer to check that the equipment is working. Step number 10. Encourage the patient to breathe the nebulized vapor through the mouthpiece or mask. Breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. Step number 11. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mouthpiece or vent holes in the mask. Remember, lack of mist ensures that the client has not inhaled the entire dose. Step number 12. Encourage the patient to expectorate, as the medication may help to loosen the bronchial secretions. Step number 13. Ensure that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Step number 14. Wash and dry the nebulizer, tubing, and mask or mouthpiece with warm, soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Step number 15. Retain the equipment in a polythene bag. For the patient's next administration and to prevent infection, the equipment should be changed every 24 hours. Step number 16. Document the nursing practice appropriately. Monitor adverse effects and report any abnormal findings immediately. This is to ensure that safe practice and enable prompt, appropriate medical and nursing intervention to be initiated.